Now, quickly trying to look at the next category of drugs, which would describe their general pharmacology. There are classes, okay, and the examples of drugs that fall under these classes. We look at the anti-epileptic drugs. These are drugs that will prevent epilepsy, right? As simple as that. Okay, so they'll prevent epilepsy, they'll prevent seizures, and all of those beautiful stories. So anti-epileptic drugs, you should just know that there are medications that would tend to prevent or reduce seizures in epilepsy and other conditions. So they act by stabilizing neuronal membranes, they reduce excitability, right, through effects on ion channels, neurotransmitters, and synaptic transmissions. So the main thing is you are trying to look at the classifications and all of that. So we have drugs that will act on sodium channels. So the ones that will act on sodium channels, we have drugs like the phenytoin. Other examples include the carbamazepine, we have the lamotrigine, and we have the valproate. So they block voltage gated sodium channels. They'll reduce what? Neuronal firing. They'll reduce how the neuron is excited. So they are used in treating focal seizures and generalized tonic clonic seizures. Okay, so next example, we have drugs acting on calcium channels. This was sodium channels. So for example, we have the etosuzimide and the valproate. This is the etosuzimide. Okay, and valproate, these ones will block the T-type calcium channels in the thalamic neurons. They are mainly used in treating what? Absence seizures. Then we have drugs that will enhance GABAergic transmission. Okay, so it will increase the GABA neurotransmitter. GABA neurotransmitter tends to calm down things, not excite them, whether it is much or not, So we have the benzodiazepine, like the diazepams, the lorazepam, phenobarbital, the tiagabine, the vigabatrin. You understand? So they will increase what? The GABA neurotransmitter. GABA neurotransmitter will basically tend to calm down the body. So they're mainly used in treating status epilepticus. Alright. So this is diazepam. This is what? Etosuzimide. Beautiful. So I have drugs acting on the glutamate transmission. We have drugs like the topiramate. We have the phenobarbital. Those ones, they block excitatory neurotransmitter glutamate receptors. Okay, used in treating refractory epilepsy, adjunct therapies too. Okay, then we have the broad spectrum ones like the valproate, the latrimogenes, the levetiracetam, the topiramate. Those ones, in many seizure types, you can actually prescribe them. So this is what we got for anti-epileptic drugs.